I think that anatomy point that you made is such a good one because the questions that patients, I do almost always find they do feel comfortable asking is the anatomy questions. The anatomy questions that maybe they'd never had an opportunity to ask anybody before, but now I'm talking about surgery on body parts, and so we can talk about it. The like most simple sort of uh, non crazy example is like, what does even a hysterectomy mean? That's probably like one of the questions that for us, you know, becomes most prominent, and differences like what's the vulva versus the vagina when we talk about something that we found in one of these locations, these sort of very basic anatomy questions, and you sort of pulled up your model. And so I wonder if you both could go through and give us some of the key, like what's the key anatomy that we all need to know to be able to start having these conversations, because it does probably help to have a little bit of an understanding of that anatomy when you're trying to describe what's working or what's not working. So do you want to, Teasley, you pulled up your pelvic floor model there. Do you want to start, or Tammy, do you want to start? Yeah, anatomy.
Actually, you can start.
Okay, great. And so as a physical therapist, just as any physical therapist is, I specialize in the musculoskeletal system and the connective tissues and how those interplay with our nervous system to promote functional movements and functional activities. And so just a little bit of, getting you oriented here. Right now, the pelvis is facing you as if it were my pelvis. Okay, so you're looking at the front of the pelvis here. And we've got our bones here on either side. And so you can see here, this is at the base of the spinal column, right? And if you do a bottom-up view, all of this red you see here, that's all muscle underneath your skin. So you have an enormous amount of muscles in multiple layers that can be involved in pelvic floor dysfunction, in addition to also connective tissue and nerves in that area, which can be impacted by each of the different cancer treatments that we've already spoken about. And so just really broadly speaking, from the musculoskeletal standpoint, from the standpoint of the muscle function, our pelvic floor muscles need to be both strong and flexible. And so I think that's a really important point, that it's not just about strengthening all the time, but it's also about coordination of these muscles. And so these muscles need to be strong to be able to hold back urine or stool, okay, to prevent leakage, right? And they also need to be strong to be able to have good sexual appreciation and sensation, and strong and fulfilling sort of orgasmic function. And then on the flip side of the coin, they need to have good flexibility. These muscles need to be able to relax and lengthen to allow passage of urine or stool, to allow the vaginal opening to become more open, more patent, to allow for penetration without pain. And so I just think that sometimes we forget that these muscles not only need to contract and lift and squeeze really strongly, but they also need to be able to relax and lengthen and let tension go. So oftentimes when I'm treating folks after cancer treatment, we're focusing a lot on that let go part.
So I have a couple of different models. I have a very different pelvis. And this one is, the genitals are here. This is the vagina. And this shows the position of the uterus and the ovaries and the fallopian tubes. So as Stephanie said, sometimes just knowing where these organs are in the body and what the surgery means can be a challenge, because we don't always get good education in our formative years. The other thing that I like to use, this is called a vulva puppet. And this is a model of women's external genitalia. So you have the clitoral hood and the clitoris here. You have the labia minora, which are sometimes called the little lips, the labia majora, sometimes called the big lips, and then you have the vaginal opening. So this is what we would call the vulva, and the vagina is a very different part. And so sometimes you also have the urethra here, which is where you urinate, and the rectum would be lower in this area. And sometimes we don't even have that sort of education to know, and it's not an area that women can look at easily. So often they're not as acquainted with their genitals as you might think, because they're kind of difficult to see. But I would encourage you to take a mirror if you never have and take a look and see what your genitals look like so you can get acquainted and see what all these things are. The other thing I often like to talk about is the clitoris. So most of us know that the clitoris is sort of the magic area that we stimulate when we're looking for orgasm or we're trying to produce pleasure during sexuality. Most people don't realize, and this is not to scale, that you only see a tiny portion of the clitoris. I don't know if you can see this little section right here is the only part of the clitoris that is outside the body, and most people call that the clitoris. What they don't know is that the clitoris is kind of like an iceberg. There's all the rest of this stuff inside your body that responds to stimulation, has erectile tissue just like man. So female bodies get erections too. They just respond a little bit differently. And a lot of people have never seen anything that looks like this and don't know that their body can respond that way. So regardless of what happens with your anatomy, there are still other players in your sexuality and in your ability to have pleasure later on, even though your body may be different now.
Yeah, and piggybacking off of that, Tammy, I really like to kind of explain to folks as well that orgasm is, as a sensation or as a phenomenon, exists in your brain. So because we typically associate orgasm with stimulation of certain genital organs, we think that if those genital organs are somehow changed or different, or if there's decreased sensation, that may mean what I may not be able to orgasm, or I may not be able to have enjoyable intercourse anymore or masturbation anymore. And what we actually know is that our brain is beautifully adaptable. And because orgasm is a function of that brain, of our central nervous system, we have many, many, many cases of folks who have, you know, complete spinal cord injury, no sensation from the waist down, and can have orgasm through, you know, touch, sensual stimulation of other areas. And so I just think that that's a beautiful point to bring up and to mention that orgasm is an incredibly complex sort of phenomenon.
And orgasm isn't the only important part about your sexual relationship. There is so much more to sex that, again, our culture doesn't always talk about, acknowledge, or address. And for some people, you know, even though orgasm is very enjoyable, there may be other parts of their sexuality that are more important to them. So we need to acknowledge that. And maybe if you've never had that conversation with your partner, or you've never thought about that for yourself, you know, maybe, you know, think about, what is it about sex that I really enjoy? And what if I have sex and I don't have an orgasm? Is that okay? Because for a lot of people, that is okay.
Mm-hmm. Yeah, I really like Tammy, and I think it's important to be able to give yourself permission and to be able to communicate with a partner if you're having partner intercourse. If there's a certain point at which you feel like you don't want to keep going on, or you feel satisfied with the encounter as it was, there doesn't have to be that end goal. And sometimes you just need to be given permission to say that, you know, what we've done together as a couple, this intimacy, this has felt really, really wonderful. I feel very close to you, and, you know, I feel very satisfied.
Yes, and your sexuality doesn't have to start at the genitals, and it doesn't have to end at the genitals. There are a lot of other erotic body parts, and there are a lot of other really erotic things that you can do, especially if you're going through this period of transition where, because of your treatment, your body is changing or your partner's body is changing. You can learn new ways to be sexual that are just as enjoyable as they've always been, maybe better.
I think that's a good line